to another day with your fertility specialist. So do well to invite your friends to come and join us. Share this link to your friends and family so that they can also benefit from this topic. So as we all know, today we are going to be talking about PCOS and fertility. And to talk about that for today, we have a very own Dr. Kenneth Ezuka. So thank you, sir. It's very nice to have you here with us again. So for those of us that have been here before, that have been following our live sessions, we all know who Dr. Ken is. He's a consultant gynecologist and IVF specialist, a reproductive biologist. He's basically one of the best in the field as we know it, and it's an honor, to be honor, sorry, to be with you again today.
Thank
Thank
you
you
so
so much for
much.
having us, sir. Okay, so of recent, in recent times, the rate at which people or young ladies or women in general have been diagnosed with PCOS, as we know it, has
Mm.
been very high. Has been very high. So, what could be the causes? What are the factors that could actually contribute to this increased rate? Because in the past, it wasn't as rampant as we know it now.
Yeah, the observation is actually quite true. And PCOS or PCOD, polycystic ovary as it's variously called,
Yeah.
seems to be getting a lot of attention these days. In fact, we have groups, a social group
Groupings.
of people with polycystic ovary, just like you have a social group of those with endometriosis and all other groups. So PCO is one of the groups that actually have been deserving a lot of attention these days. And
Mm.
just as you rightly mentioned, the diagnosis, seems to be heightened these days. But I think the reasons why we're seeing a lot of people with PCOS, it's because of increased awareness and knowledge amongst medical practitioners.
Yes.
Then improvement in technology and gadgets needed for diagnosis of these conditions, you know, and also modification of lifestyle from the traditional lifestyle that we used to know. Because see, one of the causes of PCO is genetic.
Wow.
A mother passes it to her
Offsprings.
offsprings, the females, you know. And then when you have this genetic predisposition to having PCO, or you have the genes for PCOS, and then this gene meets a favorable expressible conditions like lifestyle modifications,
Obesity.
dieting, sedentary lifestyle, and all of that, poor eating habits, then of course it manifests. And these days we see that even kids have very poor eating habits, and they eat very, very poorly, a lot of carbs and all of those. So you
Mm.
see, even uh, maybe kids in the high school, for instance, coming down with a lot of polycystic ovary, you have a lot of obesity and all of that. But then you still have lean people with
Okay.
PCOS. Okay, so there are a lot of reasons why there's an increased awareness, an increase in the rate of diagnosis. Genetic, lifestyle are the major reasons, and of course we see like in the world currently, India seems to have one of the highest rates of polycystic ovaries in the
Wow.
world. Yeah, India have one of the highest rate of polycystic ovaries. We see a lot in Nigeria. I still see, up until this very day, I saw people with polycystic ovaries. And
Mm.
to be very candid, it's one of the cases that requires the attention of a reproductive gynecologist.
Wow. So relating to that diet, I read somewhere that eating chicken can actually
Chicken. All
yeah,
right.
eating large quantities of chicken. I think it said because of the estrogen in chicken. I think is it broilers? There's a particular brand of chicken that I say
Hmm.
has high
Hmm.
estrogen. So is it scientifically proven? Like, would you say scientifically proven?
I haven't read chicken per se, but I can relate to what you're saying.
Okay.
Because we see that a lot of these grown animals, and poultry
Poultry.
birds
Okay.
are one of those animals grown in large quantities around our sub-region of the world. And
Mm-hmm.
one of the major diets they feed them on are usually adulterated with estrogen. And the
Okay.
reason is this: the marketers or the producers of these animals or these birds want them to grow fast,
Fats.
and sell them off at 6 weeks. And if you could, if you could have this rate of turnover, then the interest is money, the profit that comes from it. That way, you give them poor diets, they grow fat with a lot of fats and a lot of estrogen, and even the eggs, the eggs have a lot of
Mm.
estrogen. So you have a lot of kids and adults. I know, in this part of the world, it's like when you eat a lot of chicken, you're just living the life.
Yes, chicken is a sign of wealth.
Exactly, it's a sign of well-being, a sign of wealth. So you eat a lot of chicken, you eat a lot of eggs that have been poorly fed. I'm using my words carefully, poorly fed, because the diets that they are being fed have a lot of estrogen. So it makes sense if this estrogen is translated into humans, and then you have a lot of estrogen in the body, and this estrogen can predispose you to the manifestation of the polycystic ovaries if you have them, if you have the genes for polycystic
Duty.
ovary. It's the same reasons why you have little kids beginning to see menstruation at a very
Very
early
young
age in
age.
life because of poor feeds, and poor
Hmm.
eating habits. So yes, I could say that with chicken. Yeah, yeah, yeah. So it's good to
Uh,
eat healthy.
wow.
Yeah, it's good to eat healthy and eat some of those things in the best quantity. And then standard organizations uh, should also step up to monitor the items that are consumed in every society. So that we don't only protect people from having early manifestation
Manifestations.
of this polycystic ovary, but also a lot of other manifestations of some other diseases.
Hmm. Wow. That's crazy. Wow. I just came across it when I was reading. And I was like, wow, that was interesting. They were like chicken, then this sausage that we eat in our shawarma too.
Oh, sure.
That's also, that one also causes PCO. And I was like, oh, wow.
Yeah, so a lot about diet
Hmm.
is causing a lot of the problems we're having today. The sausages, the chicken, the eggs, the dairy products, all because they've been processed, and then been fed abnormally and all of that. So when you eat them and you eat them in large quantities, you could
Hmm.
have manifestation of some hidden conditions early in life. And PCO, of course, is one of the hidden conditions. And once it gets triggered, you may see the manifestations
Manifestations.
quickly in life.
So, what do these manifestations appear as? What symptoms can you see that would maybe make you consider, okay, maybe this is a PCO patient or you're having PCO as a person?
All right, if we go practical, for instance, those of us who work in the clinics, usually you see very pretty ladies just got married, and as the culture of our society is, uh, your in-laws and the society generally, or your colleagues at work, always stare at
Your
your
stomach.
blouses, at your stomach to see whether it's already protruding. Everyone expects you to be pregnant as soon as you get married. So they come in when these pregnancies are delayed. Yeah, they come in when they feel pregnancies are delayed, and we go in for evaluation investigations, and then you find out that this woman probably is not menstruating every month. She's not seeing a regular menstrual cycle, and you find out how long has this been. She may say, right from when I was in the secondary school, that it skips 3 months, it skips 2 months. Sometimes it comes regularly, then it becomes irregular again.
Irregular.
So you begin to know that already there is a hormonal problem going on around with this woman. And PCO is one, polycystic ovary disease is one of the major causes of these
Irregularities.
irregularities in the menstrual period, especially the ones that skip a month to some people for up to 6 months. They don't see this period. Some even up to a year.
I have
I
a
have seen
friend this
clients
once.
who sees period once in a year and it's PCO. So then you find out that it's a case of PCO. Then when you go deeper to evaluate, of course, you do your ultrasound investigation. You find out
Emissions.
that the ovary looks, there's a particular format that those with the polycystic ovary have features in ultrasound, having a lot of tiny follicles around the ovaries, and they could be in large quantity compared
Mm.
to the regular ovary that is normal. So, and that is where the poly comes in. Poly means many, polycystic,
Like many
many cysts,
cysts.
the syndrome, all the manifestation together with the metabolic abnormalities. So if you go further, you may find out that they have resistance to sugar resistance, insulin resistance. And so that is why they are also prone to having diabetes later in life and other
Wow.
metabolic conditions. But then the first point of call, what brings them to the hospital, is delay in conception. And then you see all of that. Then if you look closer, you may find out that they have the male pattern of hair
Of hair
distribution.
distribution.
They may have the mustache, they may have beards,
Mm.
they may have
Hair
hairs
on
on the
the
chest,
chest.
some hairs on the legs, the arms, the legs, then on the abdomen, lower abdomen, the male pattern of hairs. Some may not have, but they still have other features of polycystic ovaries. So some may have an unnecessary amount of acne, what we locally call pimples.
Ah.
you know they may have acne, and then maybe a sign of polycystic ovary too.
Mm.
So these are some of the problems with PCO.
Mm.
And then if you look closely, monitor for ovulation, you see that some of them do not ovulate frequently. And because they don't ovulate frequently, they don't menstruate frequently, they may be having discharge of breast milk. Yes, they may be having discharge of breast milk. So because they don't have all of this happening, ovulation frequently, menstruating frequently, they have problems with eggs production. And then pregnancy doesn't just come easily
Easily.
for a good number of them. Some get pregnant easily. But then I guess we'll talk about the kind of pregnancy they get in a bit, if you care to ask about those questions.
Wow.
So
Oh,
it's a very interesting, sensitive, and painful condition to have. It could be very frustrating.
wow.
Then one common feature is that often they may be a little bit on the bigger side, what we
Okay.
call either overweight or obese.
Obese.
Yes, and the bigger they get, the more difficult it gets treating some of them.
Mm. But does being obese, if someone is obese or maybe predisposed to being obese, can it cause the person to maybe have PCOS?
When you are obese, for instance, you could be having large amount of estrogen. The estrogen you talk about in chickens,
Mm.
or when people eat chickens and all of that. So yes, it may make the woman have abnormalities with her menstrual period
Period.
and not necessarily PCO.
PCO.
Then if you're
Okay.
obese too, there could be abnormality with production of eggs. I remember back then in school, University of Warwick in London, uh, one of my projects was assisted reproduction and obesity. And one of our research findings were that women who are obese have abnormal cell divisions with respect to egg production. So there's
Wow.
what we call the spindles, mitosis, mitotic spindles. For those who do biology, they have extra of it, and because they
Mm.
are extra, they are more than normal. The eggs are not good. Then pregnancy becomes problem, miscarriages
Difficult.
become frequent. So that's obesity on its own. But
Mm.
then PCOS or PCOD or polycystic
Sick
ovary
ovaries.
is often associated with obesity. So it's compounded problem for those who have PCO to be obese.
So you now have PCO, you'll be obese,
Mhm.
predisposed to diabetes. It
And
is a lot.
hypertension, that's just too much for one person.
Wow.
That's just too much for one person. But the bottom line is that it's genetically predisposed most times. Just as I said earlier on, I've seen a family where the grandmother had PCO, the mother had PCO, her daughters have PCO. Yeah, it's genetic. So that's what it is.
In Africa, they'll say generational curse.
Yeah.
As well. So, how does PCO, like, how can it impact fertility when it comes down to, okay, now I'm ready to have a child? Does it affect the quality of eggs that the person may have?
Mhm.
Or,
Okay, let me tell you something. We just you just mentioned quality of eggs. So I want to pick the question from that point. We just concluded a treatment for some people with PCOS. In this case, they did IVF treatment cycle. You know, so one of them produced like 20 eggs because that's their peculiarities. They have eggs in large quantity,
Quantities.
but the problem will be the quality of the eggs. We have retrieved the eggs, we have fertilized the eggs. The sperms was good, definitely, but then the rate of fertilization was slow. Not all the eggs got fertilized, and even those that got fertilized progressed to certain level. Where some got to the final stage we expected them to get to, blastocyst, but we
Mm.
monitor the rest, the others, and they had an arrest of development. So less than a quarter of the many eggs that were produced got to the stage you want them to get to. And the question is this: those eggs that got fertilized and embryos got to the stage that you want them to get are few. What is the guarantee that what caused the arrest in these other follicles doesn't is not present in this
In
one
the
that have
one.
progressed to blastocyst? So in essence, I'm just trying to say that the quality of eggs they produce is often poor. And because it is poor, when pregnancy happens with those quality of eggs, chances of miscarriages is
It's
very
very
high.
high.
And because the process of egg production in them is always tricky and substandard, the sustenance, hormonal sustenance of pregnancy in individuals with a certain degree of polycystic ovary becomes difficult, and then miscarriages becomes very frequent. So they have a lot of miscarriages. Then if pregnancy progress, a good number of them get pregnant and deliver no problem. But for some, the risk of having diabetes in pregnancy, what we call gestational diabetes, is very high. Hypertension in pregnancy is also high. Then miscarriages are high. Then the kids that are born by these parents are likely going to come down with these conditions too because it's genetic. So yeah, pregnancy prospect is very tricky. It's very
Very
low.
sketchy.
Yeah, it's very low. Especially polycystic ovary is in grades. Well, some of our guys, reproductive scientists, classify them into four.
Mm.
We have the phenotype A, phenotype B, C, and D. So now A and B are milder form of PCO. Then C and D are advanced form of PCO. When you have C and D, for instance, if I'm talking to a scientific class now, I'll be able to expatiate on all of them. For the sake of the public, C and D are the bad grade of PCO. You may treat them and they fail to produce eggs. They have a lot of what we call empty follicle syndrome. You treat them, you think they are responding to produce eggs, they show signs of egg production, but when you go to retrieve the eggs, they're all empty because the processes of egg production in them usually doesn't follow this the
The
the,
normal
the
pattern.
conventional pattern, and then you don't retrieve eggs. But somehow they may still produce eggs some other time, all on their own, spontaneously. So their body mechanism of producing egg is different. you know it's awkward, but they may still produce eggs and get pregnant and deliver. But the rate of fertility in them is lower than their cohorts that don't have polycystic ovary. So their eggs are usually a challenge. So if you see a polycystic lady with a lot of eggs, for instance, we don't celebrate because we just keep finger crossed and only
For the
hope
best.
that something good will come out of this treatment. So the prospects are usually guarded.
Mm.
So that's the fertility prospects.
Wow.
Uh-huh.
So I hope we're all learning something, because it is a big issue, and a lot of people are suffering with it. They're suffering in silence. Suffering in silence. So please do well to also share. Keep on sharing this link to people so that they can also benefit from this topic, especially if you have someone who is going through this condition and you know that this person has this condition. Please do well to share to this person. So for people with PCO, we know that they have very irregular
Yeah.
periods. Some people have once in a year.
Mm.
If there is there a way to regularize the periods, maybe mechanically or with medication?
Yeah. Now, this is a recommendation by the American Society of Obstetrics and Gynecology. Call them ARCOG. Because they don't menstruate regularly and they have a lot of cysts on the ovaries, their body produce a lot of estrogen. And this estrogen have an impact on the endometrium, which is the lining of the womb. Okay. And then the brain is tricked to feel that ovulation is happening because there's a lot of
It's
estrogen
your
coming from
dream.
abnormal cysts, and so the brain doesn't take down the stimulus for the eggs to be produced. So she stays a very long time also without ovulating, and then these eggs are arrested in a stage of development for a very long time. At the end, they become poor quality eggs. Now, the woman having PCO and who doesn't menstruate regularly is exposed to a prolonged period of estrogen. And this prolonged period of estrogen predispose her to having cancer. So they are at risk of having cancer of the endometrium, the lining of the womb. So what is recommended? I'm saying this because you asked a question about their menses.
Mhm.
So it is advisable that the gynecologist seeing them makes them menstruate at least once every 4 months.
Okay.
That's in the situation where they don't menstruate
Regularly.
regularly, and maybe for 6 months they don't go menstruating. This is so because you want to reduce the length of time that they are exposed to estrogen. Because normally a regular woman in a cycle, for instance, the body produces estrogen for like 2 weeks, 3 weeks, then progesterone comes in and breaks the cycle of estrogen,
Mm.
and then she sheds the a lining of the
Endometrium.
womb. So this renews every time in a woman who is normal. But for those having PCO, this is not so. They have prolonged exposure to estrogen, and then they are predisposed to having cancer of the endometrium and other growths in the reproductive system that is dependent on estrogen to grow. Fibroid is one of them, and other things that we may want to mention later.
Uh,
So it's good to give them medicine to make them shed the
shed the
lining of the womb
lining.
so that you are reducing the risk of all of those.
Mm.
So it's advisable, yes, to make them menstruate. Yes.
Can
And then for those who have plenty hairs on the body, for instance, or acne, you know, there are other medications that they could be given. One of such is spironolactone.
spirulactone.
Yes, I don't know the, the word in pidgin or in local language to use. That's a chemical name. It's an androgen.
Okay.
So it helps in correcting some of the abnormality with hair distribution and
Mm.
the acne, so they can have a very bright looking face and looking more like the female that they are supposed to be.
Wow. What can wow. Okay. We learn every day.
Mhm.
Cancer is and cancer is not something that just happens all of a sudden.
Mm,
But it's well so for people with PCO
mm,
that want to do IVF,
mhm.
what are the considerations for them? So what decisions do you take? What influences your decisions as pertaining their own particular case?
Yeah, now you treat every case based on its merit. And as I told you earlier on, a PCO is in different grades. We have the phenotype A, phenotype B, C, and D. The A, B are usually milder form of PCO. They can just get pregnant all by themselves, and then they may not need so much attention. The problem is when you're dealing with phenotype C and D with all the
The
features of PCO,
features.
the hairs, the acne, the lack of menstruation and all of that. Okay, so but if you have a client, for instance, with PCO going in for an
For
IVF, for
IVF.
instance, you have to evaluate them and individualize their cases. For instance, you have to see what level of hormone abnormality they have, whether they have sugar sensitivity, insulin
Like resistance.
resistance, and all of that. Then you decide how you are going to go with their treatment. For some of them, you may have to place them on some supplements,
Okay.
that help in correcting or modifying the metabolism of the abnormalities they're having. Like homocysteine, for instance, it's advisable. Vitamin D3 is advisable. Manganese, selenium, all of these things are supplements that help in improving the outcome of,
Of their
of, of egg
treatment.
retrieval and quality of eggs in an IVF treatment cycle. Well, we go to the extent, for instance, in my own center, where we do ovarian drilling because it's the most advanced treatment as we have right now for polycystic ovary. All of this is in an attempt to improve on the quality of eggs, because you could just go treat the woman, retrieve the eggs, you get a lot of eggs, and all the eggs are poor. So you have to be keen on this treatment, and you have to be very focused and diligent on the treatment to just improve her chance of producing good eggs. So those are all the things you need to do. But then you have to counsel her too, because she needs to have an expectation.
Mm.
The expectation is usually slightly low, and she needs to work with realistic expectation, because you may be seeing a lot of eggs and you are rejoicing, and then the eggs are poor.
Are poor.
you know so you need to fix an expectations for her, and also she should have a thought, or probably even getting to the extent of using a donated eggs, because sometimes for doing all of these things the eggs may still not be good. Then you have to select the protocol that is very interesting and very befitting, and with less risk in treating her, whether the short protocol or the long protocol, depending on what the inclination of the physician is. You have to select what is just ideal for her and treat her accordingly. And because they respond too frequently, too soon, and with a lot of eggs, they also are at risk of having ovarian hyperstimulation
Mm.
syndrome. So
Okay.
you have to watch out for all of that. So you have to treat them as individuals. Bottom line is that yes, they have good chance for success, but they need more attention than the regular women
And proper
undergoing an IVF
counseling too.
treatment cycle. You know, you could have all the signs that there are eggs, and then you still don't have eggs. And what do you tell her?
Mm.
There's also a chance of not having eggs after all of these things in the PCO. So it could actually be a roller coaster of a treatment. But then as a physician, what do? You stick with her and you treat her and hope that you have something good coming out of this treatment. Yeah.
Okay. So you said ovarian drilling improves their chances.
Yeah.
Like when you say drilling, is it that you poke the follicles or
Drilling means drilling.
you
Drilling means
know,
drilling.
I'm
You
trying
know,
to
it's done
understand.
laparoscopically. The ovary
Okay.
is like shaped like an egg, like a chicken egg. The
Mm.
entire ovary itself. So you can imagine using a pin-like structure
Okay.
laparoscopically to just make puncture. The drills have a energy-based drill,
Okay.
either electrical energy or laser energy. Just make some punctures on the ovary, because the ovaries of a polycystic individual has a lot of fibrous tissue.
Okay.
Yes, and usually have thick covering, and those thick covering just prevent a lot of activities going on. Ovulation is one of them, the hormone abnormality one of them, helping production of the luteinizing hormone that is usually very high. So when you drill, you burn the stroma of
Okay.
the ovaries and makes the ovary light to produce healthy hormones and easy ovulation and menstruation. We've done a lot of that from a lot of clients whose problem is no menses before, or abnormal menses, and it corrects it. Then you could do that, and then you don't even need to give medications for ovulation induction, and they get pregnant all by themselves. You know, so it improves on the outcome of fertility treatment for anybody with good size of ovary going through fertility treatment. So you could have drilling and they don't need IVF. But at the same time, you could have drilling and you progress to IVF, ovarian drilling. It's done laparoscopically. So that's what I mean. It's not
Okay.
like you're drilling drilling
Because
a drilling a borehole in Africa.
because when you hear drilling as a layman, you're like, drilling. What do you want to do? What do
Just to
you do?
drill something,
Yeah, how is it going to
Oh
happen?
yeah. Maybe
Okay,
one day we'll show some of the videos of ovarian drilling
that'll be
so women know.
interesting.
But then we have some of them online. Just go online, you see it's a very basic, simple procedure. When treatment for for polycystic ovaries started, um, it started by chopping off part of the ovary. We call it a wedge resection of the
Mm,
ovaries. You cut a wedge. Wedge is like doing a V,
a V
inverted
shape.
V into the ovaries. Then you close back the ovaries. Uh, all of this is to reduce the thickness, the stroma of the ovaries, so that
Okay.
some normalcy can return. But then, a lot of side effects with this kind of surgeries, adhesions, and all the other complications that goes with them. And of course, trust science. You may be crude today, but tomorrow you get refined. So it's refined to the point that you don't have to cut a woman open. You may just make a hole on the abdomen, three to four holes, and put in your electrical gadgets.
Hmm.
And then you make drill under electric or laser energy at several points on the ovaries, depending on the
The
size of
size
the
of the
ovaries.
ovaries.
And then
Do what you need to do.
and you're out. And then the woman can go home same day or the next day, as against the surgery that she can spend some days in the hospital. So that
Hmm.
is the evolution in the treatment of a polycystic ovary. We came in from wedge resection, then now we are at laparoscopic ovarian drilling. And when you have this done for a client, it improves our prospects at all the symptomatologies of ovarian polycystic ovary disease,
Ovaries.
whether ovulation, menstruation, miscarriages, and egg quality. The drilling seems to do a lot. It's superior to the medications used, if
Hmm.
not treatment for IVF
From
that require a lot of injections. So that's the drilling. That's what it's all about.
wow. So maybe one of these days we'll show you guys the video of the ovarian drilling so you can know that it is not as painful as it sounds.
No, it's not painful actually because it's done under
Under
anesthesia,
anesthesia.
so there's no pain associated with it.
All right.
Mhm.
Thank you.
Yeah.
All right. So how does does a PCO affect just fertility? Does it affect day to day living, your
It
general?
affects everything. It
Mm,
affects the life of a woman, It affects fertility, predispose her to having diabetes, predispose her to having hypertension, may predispose her to being obese, and having a lot of cosmetic effects. Imagine a woman with hairs and beards like men,
mm,
and then I don't know how it's accepted in the female world. She'll be
it's,
looked as differently.
it's not
So they
accepted.
have a lot of mood abnormality, a lot of psychological or let me psychiatry abnormality, a lot of mood swings, depression, and all those ranges of mental abnormalities. It happens with them. The way they look physically is also a problem to them. The hairs and all of that. So they may require a lot of cosmetic intervention. The waxing, either the laser or the waxing modality of hair
Sugar
removal,
strip.
the using of medications, anti-androgens medications to help to control hair growth and also improve their ovulation. Then a good number of them would need the regular medications like the clomid, the letrozole to induce ovulation because on their own they may just not ovulate. So it affects the life generally. And sometimes it could be so annoying that after not having menses for 3 to 4 months,
Mm.
the menses just shows up and she bleeds for over 1 month. And sometimes this bleeding can be so annoying, it may just be spotting and spotting and spotting. Then you can imagine a woman having spotting of blood for 1 month.
So
So it's
inconvenient.
inconvenience it in every way you want to look at it.
I know.
So she's always going to be conscious of herself, having sanitary pads all the time. So you could see that it's just not a very comfortable condition to have. You could speak well of it, but there's just nothing good about it.
So for our people out there with PCO, what do you have to say to them?
It's just a condition, and
Yeah.
it's painful to have, though, yes, but that's not where life ends. You can make good thing out of it. Take the life the way it is and see a good reproductive gynecologist or gynecological endocrinologist to help improve your outlook to life. You manage it and do what it takes for you to be comfortable with your condition.
Can also
And if
see
you
a
get to fertility,
psychiatrist.
yeah, if it requires seeing a mental health expert, of course you do see, but then it's just a condition, but that's not where life ends. A good number of people with PCO are very good people, have a very good outlook to life. So you could make something good out of your reproduction, out of life generally having PCO. Yeah.
So, for people living with PCO, I hope you know that it is not the end of the world. There are still options for you. There is hope for you as regards your general life and your fertility as you may desire later in life. So thank you so much, Dr. Ken, for
My pleasure.
having
Always.
us today. I really hope we all learned something. Please do well to like our post, do well to like this video. Also share to people who were not able to join so that they can also benefit from this session as we know it. Thank you so much for your time. Have a blessed day.
Thank you.